Our world, a tapestry of life, has always been shaped by forces of nature. Among these forces, pandemics stand out as formidable adversaries. Long before recorded history, plagues swept across the globe, leaving devastation in their wake. One such plague, the Plague of Athens, struck in 430 BC. This devastating outbreak, likely typhoid fever, ravaged the ancient city-state. It claimed the lives of thousands, including the great Athenian statesman Pericles. The Antonine Plague, named after Roman Emperor Marcus Aurelius Antoninus, emerged in 165 AD. This pandemic, possibly smallpox or measles, swept through the Roman Empire. It weakened the empire's defenses, contributing to its eventual decline. These ancient plagues, though lost to the mists of time, offer valuable lessons. They remind us of the vulnerability of human populations to infectious diseases. They underscore the importance of understanding and preparing for future pandemics. The Black Death, a bubonic plague pandemic, stands as one of the deadliest in human history. It first appeared in Europe in 1347, brought by merchant ships traveling from Asia. The plague spread rapidly, carried by fleas that infested rats. Symptoms of the Black Death were horrifying. Swollen lymph nodes, fever, chills, and blackening of the skin were common. Death often followed within days of the first symptoms. The plague killed an estimated 25 million people in Europe, a third of the continent's population. The Black Death had a profound impact on European society. It disrupted trade, decimated populations, and led to widespread fear and panic. The pandemic also had a lasting impact on art, literature, and religious beliefs. Smallpox, a highly contagious viral disease, plagued humanity for centuries. It caused fever, pustules, and often left survivors with disfiguring scars. Smallpox was responsible for countless deaths and played a role in the fall of empires. In the 18th century, Edward Jenner, an English physician, made a groundbreaking discovery. He observed that milkmaids who contracted cowpox, a milder disease related to smallpox, seemed to be immune to smallpox. This led to the development of the world's first vaccine. The smallpox vaccine proved to be incredibly effective. Through widespread vaccination campaigns, smallpox was eradicated in 1980. This marked a major triumph for public health and demonstrated the power of vaccines in conquering infectious diseases. The Spanish flu, a devastating influenza pandemic, swept the globe in 1918. The virus spread rapidly, facilitated by the movement of troops during World War I. The pandemic infected an estimated 500 million people worldwide, about one-third of the global population. The Spanish flu was highly deadly. Unlike seasonal flu, which typically affects the very young and the very old, this pandemic killed healthy young adults in large numbers. Symptoms included fever, cough, and pneumonia. Many died within days of becoming ill. The Spanish flu had a profound impact on societies around the world. It overwhelmed healthcare systems, disrupted economies, and left a lasting legacy of fear and uncertainty. The pandemic highlighted the interconnectedness of the world and the importance of global health cooperation. Section 5, HIV/AIDS, a modern pandemic. HIV/AIDS, a chronic and potentially life-threatening condition, emerged in the 20th century. HIV, the virus that causes AIDS, attacks the immune system, making it difficult for the body to fight off infections. The virus spreads through contact with infected bodily fluids. HIV/AIDS emerged as a major global health crisis in the 1980s. The pandemic had a devastating impact, particularly in sub-Saharan Africa. It claimed millions of lives and had profound social, economic, and health consequences. While there is no cure for HIV/AIDS, significant progress has been made in treatment and prevention. Antiretroviral drugs can control the virus, allowing people with HIV to live long and healthy lives. Prevention efforts focus on reducing risk factors, such as unprotected sex and sharing needles. Section 6, SARS, a warning shot. SARS, or Severe Acute Respiratory Syndrome, emerged in 2002. This viral respiratory illness caused fever, cough, and difficulty breathing. SARS spread rapidly from its origin in China to other parts of the world. The SARS outbreak triggered a swift and coordinated global response. Public health measures, such as isolation, quarantine, and travel restrictions, were implemented to contain the virus. The outbreak was relatively short-lived, lasting about 8 months. While SARS did not reach the scale of a global pandemic, it served as a stark reminder of the interconnectedness of the world and the speed at which infectious diseases can spread. The outbreak highlighted the importance of early detection, rapid response, and international collaboration in containing emerging infectious diseases. See Section 7, COVID-19. A pandemic of our time. COVID-19, a novel coronavirus disease, emerged in late 2019. This highly contagious respiratory illness is caused by the SARS-CoV-2 virus. It spread rapidly from its origins in Wuhan, China, to become a global pandemic. COVID-19 has had a profound impact on the world. It has claimed millions of lives, overwhelmed healthcare systems, and disrupted economies. The pandemic has also led to widespread social and psychological consequences. The global response to COVID-19 has been unprecedented. Governments implemented lockdowns, travel restrictions, and social distancing measures to slow the spread of the virus. Scientists raced to develop vaccines and treatments. Section 8, Lessons Learned, Preparing for the Future. The history of pandemics offers valuable lessons for the future. Pandemics are a recurring threat to humanity. They can emerge unexpectedly and spread rapidly in our interconnected world. Preparedness is key. We must strengthen public health systems, invest in scientific research, and promote global cooperation. Early detection, rapid response, and effective communication are crucial in containing outbreaks. Vaccines are powerful tools in the fight against infectious diseases. We must continue to invest in vaccine development and ensure equitable access to vaccines for all. Public trust in science and public health measures is essential for effective pandemic response. By learning from past pandemics and working together, we can build a safer and healthier future for all.